your heart stopped or you stopped breathing, would you want CPR? For a lot of us, our initial response to that question may be, of course, why wouldn't I want to be brought back to life? And yet, many patients choose what's called a do not resuscitate order, a DNR. Why do some people choose DNR while others choose resuscitation, also known as full code? This video is designed to help you understand the difference between full code, DNR, and a third term, DNI, which stands for do not intubate. Understanding these options for your code status will allow you to make informed decisions about what's best for you or your loved one. It will also help you clearly communicate your wishes to your physician and care team so that they are able to provide the best medical care possible while respecting your wishes. Television shows and movies have conditioned us to believe that full code is painless and highly effective. Often the patient comes alive in the middle of CPR, then begins speaking and seems perfectly normal within seconds. However, television is not always based in fact. For the most seriously ill patients who undergo CPR and are revived, about 15 to 20% will leave the hospital alive, and only 5 to 10% will survive longer than 1 year. Undergoing CPR is a type of procedure, much like surgery. The chest has to be compressed deep and hard enough to reach the heart so that blood can be moved to the vital organs. As part of the resuscitative effort, CPR is often accompanied by electrical shocks to the chest, IV medications, and intubation, which is a breathing tube inserted into the throat. Given the nature of these procedures, there can be complications, such as broken ribs, damage to internal organs, and often the patient's overall prognosis is worsened.
CPR can cause the esophagus or the stomach to rupture. Your organs don't get enough blood, so they don't get enough oxygen, and especially the brain can get affected by that. So if it takes too long to get things started again, your brain can take away damage.
The effort itself, if successful, does not eliminate all the medical problems that the patient is dealing with. It only brings them back to that moment before their heart stopped or their breathing stopped, before they required CPR.
The younger and healthier the patient, the better the chances that they'll survive the resuscitation with fewer long-lasting consequences. However, for older patients or for patients with chronic or terminal illnesses, the chances of surviving CPR are less, while the risks are considerably higher. The term "do not resuscitate" is widely misunderstood. Studies have shown that many patients believe "do not resuscitate" means they will get substandard care or that nothing will be done to save their life. In reality, "do not resuscitate" or DNR means after a patient dies, no aggressive measures like CPR will be performed to try to revive them. They will be allowed to die peacefully. In fact, there's a push by some healthcare experts to rename DNR to AND, allow natural death. A patient's code status has absolutely no impact on the care a patient receives for the conditions that they are being treated for. A DNR code does not mean that doctors will withhold life-sustaining treatments, like dialysis, feeding tubes, and advanced ICU care.
Code status is a guide to what the patient and or family wants should there be a heart and respiratory cessation stoppage. But it does not influence any other care that the patients receive. So it has to be always clarified that we're not talking about abandoning the patient and their care. We're talking about respecting their wishes.
It's a personal decision, and a lot of people say, I want to live the life I have. I want to enjoy the time I have, but once it's my time to go, then I want to go in peace, and I want people to let me go.
Patients who choose DNR also often choose DNI, do not intubate. Intubation is performed when there's a likelihood that the patient will not be able to breathe on his own. This nearly always occurs as part of CPR. During intubation, patients are given drugs that allow them to tolerate the discomfort the breathing tube causes. The complications of intubation are also far less severe than CPR. One can choose DNR without choosing DNI. Electing DNR only means that CPR and shocks to the heart will not be performed, but intubation can be done. What is most important to you? Quantity of life or quality of life? Many who choose full code have a strong belief that life should be preserved and prolonged at any cost. And they are willing to accept the potential consequences, even if it means their condition could worsen. On the other hand, many who choose DNR or DNR plus DNI choose to allow natural death to take place, while still receiving all the care, medication, and technological assistance available until the moment of death. Only you can decide what choice is right for you. We hope you found this video informative and helpful. If you have any additional questions or wish to discuss this topic with your physician, he or she will be available to answer questions and will assist you in making your code status decision.